A 60-year-old man with a history of benign prostatic hyperplasia, BPH, presents to the clinic with complaints of worsening flank pain and difficulty urinating. He reports experiencing low-volume voids throughout the day, occasionally followed by a sudden release of a large volume of urine. He denies fever, chills, or hematuria. On physical examination, his bladder is palpable and distended. Which of the following findings would most likely be associated with this patient's condition? A. Hydronephrosis on renal ultrasound. B. Hypercalcemia. C. Elevated liver enzymes. D. Hyperkalemia. E. Abdominal aortic aneurysm on CT scan. Before going forward, please pause and write your answer in the comments. Now let's find out the correct answer. Answer: A. Hydronephrosis on renal ultrasound. Explanation: this patient's symptoms are consistent with obstructive uropathy, which occurs when there is a blockage in the urinary tract that impedes the normal flow of urine. This condition often presents with flank pain due to increased pressure in the kidneys, low-volume voids due to incomplete bladder emptying, and occasionally, high-volume voids when the obstruction is temporarily relieved. In bilateral cases, it can lead to renal dysfunction. The most likely associated finding in obstructive uropathy is hydronephrosis, which would be visible on a renal ultrasound as dilation of the renal pelvis and calyces due to the backup of urine. This is a critical diagnostic clue that supports the diagnosis. The other options, hypercalcemia, elevated liver enzymes, hyperkalemia, abdominal aortic aneurysm, are not directly associated with the clinical picture of obstructive uropathy. Key takeaway: obstructive uropathy should be suspected in patients with flank pain, low-volume voids, and a palpable bladder, with hydronephrosis being a key diagnostic finding on renal ultrasound. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.